Hello everyone, this is Dr. Janaki, Yalamanchili. I am the consultant dermatologist in KIMS hospitals, Kondapur. Today I would like to talk to you about skin cancer, as May is the Skin Cancer Awareness Month. So, although skin cancers are not as common in Indians as in Western countries, we do see a fair increase in the number of skin cancer cases in India as well. This could be associated with a high incidence of UV exposure or exposure to heavy metals like arsenic, or also chronic inflammation or patients who are on chronic immunosuppression. So, how do you know if it is a skin cancer lesion or a normal lesion? There are three different types of skin cancers. Basal cell carcinomas, which are very common all over the world, are not as common in India. In India, we see more number of squamous cell carcinomas. And the other rare type of carcinoma that is seen is melanomas. So, how do you know if a lesion is a cancerous lesion or a normal lesion? So, if you are seeing an increasing number of any skin lesion, there is a sudden increase in the number of moles or freckles or any pigmented lesions on your body, please get it immediately evaluated by your dermatologist. Increase in the size of the lesion, any pain or irritation on the lesion, or if there is any irregular borders of the lesion, these are all important signs to look out for. Any non-healing ulcers also for over 4 weeks need to be examined by a dermatologist. So, who are the patients who are more prone to skin cancers? So, if you have a family history of skin cancer, it is very important that you get checked yearly once by a dermatologist. The second most common group in which whom we see skin cancers are farmers who have chronic exposure to sunlight during the peak sunlight time. There is a lot of UV exposure. So, it is important if your family members work outside in the sun for long hours, please keep an eye out for cancers. And patients who are on chronic immunosuppression due to any other disease are also prone to skin cancers. Patients with chronic inflammatory disorders like arthritis and other conditions can also be prone to skin cancers. So, though skin cancer is one of the most common type of skin cancers, it is also one of the most preventable type of skin cancers. How can we prevent skin cancers? Is the number one step is early detection. So, it is important to meet your doctor immediately whenever you notice anything different. And the next most important step is sun protection. Wear protective clothing, wear a hat, or cover yourself when you're out in the peak sun. And the next most important thing that you can do is usage of a sunscreen. Although skin cancers are the most common type of cancers, they are also the most preventable ones. So, how can you prevent skin cancer? The number one step in prevention of skin cancer is sun protection. So, protecting yourself by wearing protective clothing, hats, umbrellas when you're out in the sun is a very important step in prevention of skin cancer. The next most important thing that you can do to protect yourself is usage of sunscreen. Using a good sunscreen with a high SPF is very important. And the next thing is yearly checkups. Get your skin checked yearly if you have any doubt of having a skin cancer or any rapidly growing skin lesions. Thank you.